Hi everyone, I'm Michelle Wellman, and on this month's City Scene, the effects opioids have on the city of Sioux Falls, a proposed new veteran cemetery, and an update on the road construction season. Hi everybody, and welcome to this month's City Scene. Road construction season is finally winding down, but some of those projects are going to have to wait till spring because of our rainy summer. Here's Shannon Austin to fill us in.
Hey Sioux Falls, Shannon Austin here with the last wrap-up for the 2018 construction season. Yay! We welcome to the show Dina, who has been a regular on the show this season. Dina, we are going to talk about a couple of projects. Let's start with 85th Street from Louise over to about Hughes. We were just at that project probably in midsummer. Can you tell our folks what's going on?
Sure. The project has for the most part wrapped up. We're still installing the signals at Louise and 85th Street.
And how come that takes so long?
The manufacturer of them, it's just a very long process. Okay. And it's a huge demand. So it's the supplier. Okay. It just takes a while to get here. Okay. So we're still working on those signals and also the signals at Hughes and 85th.
So is there any more work that our drivers will see out there going on and then over the next couple of months?
There's still a little cleanup work in the channel left, but that too should be wrapping up here at the end of this week to the beginning of next.
So we had pictures of it, or even those drivers that have driven down 85th Street, there used to be a ditch and reeds. Does it look really different?
Oh yes, absolutely. Now it's a full urban section, so you have the raised median with trees down the center, and you have curb and gutter and turning lanes, and it's a lot of improvement.
Great.
A big part of this project was drainage, and we installed a lot of underground storm sewer, as well as cleaning out the channel and the detention pond on the south side. So yeah, that's really kind of helped those neighbors with that nuisance water that's around.
Okay. Well, looking forward then to 2019, will there be any follow-up work in 2019 that'll be done?
So currently we're working with the same consultant who designed this portion and working on the next portion. So we started kind of a preliminary design of what the next section would look like.
Okay. And so will that go all the way to Tallgrass or just unknown at this time?
We're looking all the way to Tallgrass, but there again, it's still kind of up in the air of what our limits would actually be.
Okay, because we are studying an interchange at 85th Street and 29, so there's going to be a lot of projects probably in the next 5 years, isn't there?
Correct, yeah.
So then jumping over to the same part of the city is we had a project at 43rd and Terry was the storm drainage improvements. What's the status of that project?
So right now we're kind of wrapping up for the year. The entire project was a 2-year project. So we are very comfortable with where we are stopping this year, especially with the summer that we had, and then what work we have left for next year.
And then the overall completion date then in 2019 is when? Midsummer or late?
It'll be about midsummer. We're looking at August, yeah.
All right, well, we'll get to spend some time together next year too.
Yes.
So our next update is still on the west side of the city, and it's our huge project for 2018. It's Ellis Road from 41st Street all the way up to about Stony Creek. We welcome back to the show John Heck from KLJ. John, that has been a challenging project. It's been a lot of rain and a lot of, I guess, upset drivers. Where are we at with the project today?
Currently right now, Shannon, we are kind of buttoning up what we've had in progress, graveling up to Stony Creek. They are going to try to get a little bit more paving done to get some access to some residents between 26th and 22nd Street.
Okay. Is the intersection of 26th and 22nd paved today?
26th Street is all paved out. We've got a few curb and gutter things to do. The plan is to have between 26th and 41st Street open to traffic.
Good, so that's one good thing. And then the section between 41st and 26th Street will be completely open also, is that right?
Yep, that'll be completely open.
So over the winter time, will our drivers have to be traveling on any type of gravel surface, or we just don't know that yet?
No, there won't be any gravel surfacing that they'll travel on. We will have temporary asphalt crossings with 22nd Street and Stony Creek. Ellis Road between basically 26th to Stony Creek will be closed to through traffic.
Okay. So next year, let's look forward. When do you think they'll start, and when do you think they're going to stop?
I would say next year we'll probably start to see work occurring or starting early to mid-April.
Okay.
There's a lot of back of curb work to be done between 41st and 26th Street, so we'll see.
And that's like sidewalks and stuff?
Sidewalks, okay. There's the median pavements to do, so we'll see one-lane closures,
okay.
maintaining through traffic for that type of work. Underground utility work still needs to continue north of Stony Creek, okay. and then the paving and grading will follow that.
So does it remind me again, does that paving go all the way to 12th Street, or does it stop?
No, it stops roughly about 1,000 feet north of Stony Creek with a full median section, okay. and then there'll be a concrete transition section to match back into the existing concrete that's okay. south of 12th Street.
Well, is there anything you want to say to our drivers out there?
I would say just be ready for the opening, and drive with caution through there, and
right.
be prepared for next year for some additional, unfortunately, closures and things like that, but we'll get through it.
Well, hopefully we won't have as much rain, maybe.
Exactly, exactly.
Well, we'll definitely be in touch and keep track of what you're doing next summer. So thanks so much for your time today.
You bet. Thank you, Shannon.
So we're on the east side now, and a project that seems like it has been going on a long time, but it's just been almost a year now, is the Arrowhead Parkway from Sycamore to about Highline. And we welcome back to the show Mike from the DOT. So, Mike, is there any good news you can tell our viewers about the Arrowhead project?
Yes, the good news is that we've finished all mainline paving, and you will see 2 lanes of traffic open, flowing in each direction.
So. And that'll be all through the winter time. No, perfect.
No, okay. What you will see during the month of November here is single lane closures
okay.
Along there to finish up some sidewalk work and otherwise back behind the curb. And just your regular cleanup work, punch list items.
Okay.
But no, traffic will be flowing in each direction and should be back to regular traffic flow.
That'll be great, huh?
Yes.
All right, so then going to my favorite project, which is Veterans Parkway. We have spent a lot of time out there this summer. How's the contractor doing on the structures and all the grading?
Yep, structures and grading are going decent. Grading wise, the contractor is I would say, in our phase 1, I would say is 90 to 95% complete with his dirt.
Okay.
You'll see in the month of November for a couple weeks here yet, the scrapers driving back across Rice Street.
And they're using that little traffic signal.
Yep,
okay.
yep. We have a temporary traffic signal out there. That you'll continue to see that for the month of November. Once things start to get colder, we're not going to be able to haul as much dirt or otherwise. So that operation will cease, and Rice will flow freely. We have closed the eastbound on-ramp and off-ramp at Interstate 90.
Okay.
That opens up another 200,000 cubic yards of dirt for the contractor to move, hopefully here yet this fall. And then it's, really from a traffic aspect out there isn't a lot of, because it's a brand new road.
Sure, sure. Okay.
So I would see next year we'll be paving, we'll be building the bridges, and are gunning to get that thing open either in the end of 2019 or 2020.
So a lot of our drivers, they don't really understand how much, dirt that we have to move. But with that project, you can really see where the dirt has been taken from one spot and moved to the other, and just how the different layers have continued to climb.
Yes, it's we have 70-foot fills out in some areas. Yeah. Yardage wise, it's 1.4 million cubic yards out on the project.
Yeah.
It's just a lot of dirt.
Yeah. And how's the realignment of 60th Street North?
60th Street is pretty well complete. The realignment from a grading standpoint, so we're kind of in that same phase where we have to put in our granular base and be ready for concrete next year.
Okay, so there'll be a lot more visual things to see next year once the paving starts.
Yes, absolutely. Yeah. Like anything, it kind of seems like things drag along until that concrete gets started and replaced, and then things start to take shape.
Well, it sounds like you still got a lot of work, so I'm sure we're going to be out there again next
Yes,
summer.
absolutely. Come on out. We always love having you.
Thanks so much for your time.
You bet.
So, Sioux Falls, be ready for the upcoming 2019 construction season. We have a few projects here that we're following up on. A lot of traffic signals still going up on our 2018 projects. But next summer, look for projects at 26 and Southeastern. That will be under construction for 2 years. We also have improvements going on at 69th Street from Louise over to Tallgrass about. We're going to improve that very tired street. and improvements at 57th and Solberg. Those are just a few of the main highlights for the season, but in the next episode, we'll be talking more about what's to come. So stay tuned.
Thanks, Shannon. Folks, did you know that daily, on average, 115 people die due to the opioid epidemic? You know, and that's not just the major metropolitan areas, but it's here at home as well.
Thanks for joining us. Today we have Dr. Jennifer Tingley, our Chief Medical Officer with Falls Community Health, here to talk about the concerns around opioids and if we have any of that in our community and what we can do to help people who may be addicted. So let's just start off a little bit. Tell us what an opioid is.
Yeah, so I think when people think about opiates, the first thing that usually comes to mind is a pain medication, something like morphine or OxyContin, oxycodone. A lot of times we consider those as opiate pain medications, something that helps people after surgery or if they're dealing with pain associated with cancer. But heroin is also an opiate. And so when we talk about the opiate concern or crisis across the country, we are talking both about prescription medications as well as heroin use.
Okay, and so what are we seeing in our community? Do we have that crisis level? Do we have a concern?
Right.
Or what are we seeing here?
Right. I mean, I think we don't want to just jump and say we have an opiate crisis here in Sioux Falls or even in South Dakota, but we definitely are seeing an increased rate of opioid-related ER visits, opioid-related deaths. This concern that is spread across the entire country has not left Sioux Falls out of the picture. I mean, definitely it is something that we should talk about. We are working on getting the help that people might need when they are struggling with opiate addiction.
Okay, so when people are starting with their pain medication for whatever reason or something like that, what are some of the risks? What do we look for when people start to get addicted?
Yep. Well, opiates in general, when somebody would use an opiate, the thing we worry the most about is respiratory depression, meaning that their breathing slows down, their drive to breathe slows down. And so people will potentially overuse those medications and stop breathing. And that obviously is the major concern we have when we talk about respiratory depression and opiate use. Now, the medications themselves are very addictive, and so some people may use a pain medication and be fine. They could use it for a couple days and they're done. But some people start using it and they find that they can't stop using it, that they enjoy the way it makes them feel, or that they can't get through their day without it. That is when we really get concerned about an addiction, an addictive process going on.
Okay, and so as a prescriber in our community, what are the prescribers, the physicians, physician assistants, all of that doing to help cut back on some of this?
Right. And certainly because this has been such a national problem, there's been a lot of education coming down from the Centers for Disease Control, all of the licensing boards for medical providers to encourage prescribers like myself and others to not use opiates as liberally as perhaps we once used to. So to give a very short course of pain medications if it is necessary, to decrease the strength of that medication that we might be prescribing. So we've been really pushing our prescribers to use less of that medication so that we prevent those problems from happening for patients.
Okay, and so if you have a patient who comes in and you find that they have now become addicted to the pain medication they're on, what are some of the options that you use?
Yep. So I think of, there's different levels of treatment that we could offer. I mean, clearly those patients that are struggling with very strong addictions, if their life is very negatively affected, they may need an inpatient program. They may have to go somewhere to get off those medications, to build that support system around them to not be able to use. However, not everybody needs inpatient treatment. There are plenty of options that we can do on an outpatient basis, just in a regular clinic. Within family practice clinics, we can provide medications that will help people not want to use that opiate anymore, may help them get through the withdrawal symptoms of using those opiates. And then there are also treatment programs where people go every single day and get a medication. Here in Sioux Falls, we have one of those. It's the Sioux Falls Treatment Center, and they use methadone. And that would be a daily dosed medication to help with that person's dependency.
Okay. So there are options out there.
Yes.
So if somebody feels themselves struggling or sees a family member struggling, what would you say should be their first step?
My encouragement, first step is to talk to your primary care provider. Whether or not that primary care provider is using those medications that can help treat dependency and addiction, asking somebody first, because that person may not prescribe, but they know who in the community does. And we certainly are seeing an increasing number of facilities and providers that are using this medication-assisted treatment. So really just ask your primary care provider and they will find the right place for you to go, or your family member.
Okay, well, we very much appreciate your information and talking about this very difficult topic.
Yeah.
But it affects so many people.
It sure does.
Thank you, Dr. Tingley.
Yeah, thank you, Katie.
The City of Sioux Falls will host the 6th Annual Big Sioux River Water Summit on December 6th from 1 till 5 p.m. at the Hilton Garden Inn in downtown Sioux Falls. The summit presents an opportunity to work to improve and conserve the Big Sioux River as a natural resource. This event is free and open to the public. Learn how to conserve water and contribute to area efforts to keep the Big Sioux River clean and healthy. Learn more about the event at siouxfalls.org/green.
Hi, I'm Dr. Jensen from Falls Community Health, here today to talk about Legionella. Legionella is a bacteria that can cause community-acquired pneumonia. Legionella presents like any other pneumonia with progressive cough and fever. It is often underrecognized and underdiagnosed. You are at greatest risk for Legionella causing pneumonia if your age is greater than 50, you are a current or former smoker, have COPD, are immunocompromised, or have other underlying illnesses. People contract Legionella by water droplets in the air from contaminated air conditioning systems, decorative fountains, or hot tubs. If you have any questions about Legionella, contact your primary care physician or Falls Community Health.
Welcome back, everybody. Did you know that Sioux Falls will be hosting the Big Sioux River Water Summit in December? Here's some info.
I'm Jesse Anayans. I'm an environmental analyst for the City of Sioux Falls, and I'm here to talk about the Big Sioux River Water Summit in early December. At the Big Sioux River Water Summit, it's a chance to learn about our water quality initiatives for the Big Sioux River and also hear about projects that are happening locally, regionally, and even nationally to improve the quality of water for everyone. This year we have a keynote speaker, Jeff Zimprich, who's our South Dakota State conservationist, and we also have 9 other tracks where speakers are going to be coming and talking about water quality projects and water quality initiatives and what's really going on in our watershed to improve the water quality of the Big Sioux. Some of the main things we're going to be talking about at this year's event is one of the water quality projects we have going on is the Big Sioux River Water Quality Project to improve the water quality north of Sioux Falls for water that's coming in. We also have some speakers on fixing some of the erosion issues of the Big Sioux River in town and north of town. We also have some stormwater talks to talk about how stormwater affects the water quality in the Big Sioux River, and just a lot of talks about how everybody can become involved in the project and help improve the water quality. The one biggest thing that we've seen is the Skunk Creek, which just comes into the Big Sioux River here in Sioux Falls, was actually delisted, so it was taken off for total suspended solids. It's one of the parameters that was a problem with that area of the river, and they've actually removed that. The state of South Dakota has removed that, so that's one of our big wins for water quality in the Big Sioux. And we know a lot of these initiatives take a lot of time, but we are seeing some improvements, and some of those talks will actually talk about those improvements we're seeing. And if you want to join us, it's going to be on Thursday, December 6th from 1 to 5 p.m. You don't have to pre-register, you don't have to sign up for anything, just show up, go into whatever talk that interests you during this summit, listen to our keynote speaker, and we really hope that just anyone that's interested in water quality, whether you're a professional or just an interested citizen, can come to this event. It's free, like I said, no registration, just come on in.
Hey, did you know that recently the City of Sioux Falls gifted 60 acres to our Department of Veterans Affairs for a proposed cemetery? Here's a councilman to explain more.
I'm just north of the City of Sioux Falls, just north of Interstate 90 and north of 229 on a piece of property that the City of Sioux Falls has owned for many years. This property was originally purchased to meet the city's water needs in the future. We were going to, at that time, the plan was to dam up Slip Rock Creek and create a reservoir. Since that time now, we have rededicated the property for another purpose. About 2.5 years ago, members of the South Dakota Veterans Council approached Councilor Rex Rolfing and myself to see if we could assist them in identifying property that would be suitable for a state veterans cemetery. At that time, we were informed that South Dakota is just one of 5 states in the nation that does not have a state veteran cemetery. Currently, the closest cemeteries for veterans are located in Sturgis, South Dakota, and Fort Snelling, Minnesota, which is obviously quite a distance for our veterans to travel and for their families to travel. South Dakota has over 72,000 veterans, which incidentally is very high on a per capita basis. Over 50,000 of those veterans live East River. So the veterans on the east side of the state have been underserved in terms of their cemetery and burial needs. Well, as you can see, the crop has been removed recently, but this property north of town is made up of rolling hills and a couple of different creek beds to the east and to the south, shelter belts to my back, and the view is absolutely spectacular. It's breathtaking, and quite frankly, I get emotional when I think about this being utilized as a state veteran cemetery and looking at the rows and rows of marble headstones. It's an absolutely breathtaking sight, one that I think we're very fortunate that we were able to identify this as a site for the State Veteran Cemetery. The cemetery is intended obviously for veterans and for active duty members that were killed in service to their country, as well as members of their family that are eligible. Their spouses would be eligible, and any dependent children would be eligible as well. And the federal government would reimburse the state of South Dakota a little over $750 for every veteran that is buried here at this site, and that money then would go back in support of operations of the cemetery in the long term. I've been asked, why is this necessary? It's necessary to pay back the services that our veterans and our active duty members have been performing. As I mentioned earlier, they've been underserved in terms of burial options. Their family members have committed much and are often overlooked in this whole process as well too. While I did not serve in the military, my father did. My dad, Bob Kiley, joined the United States Navy back during World War II, actually lied about his age at the time of enlistment and went into the Navy at age 16. I did not fully appreciate the impact that serving his country had on him until just weeks before his death, when he was in hospice, and he started to relate a little bit about his time in service. It was at that time that I learned he had actually been at Normandy during the D-Day invasion, and he couldn't really tell me any more beyond that. So I dedicate this to our veterans and to their families and to my father, in the memory of my father as well.
And finally, folks, here is our latest 80 and 18 Park with Jackie Nelson.
Hi, I'm Jackie Nelson, Administrative Manager with Sioux Falls Parks and Recreation, here to talk to you today about 80 and 18. 80 and 18 is our challenge for the year of 2018 for residents and visitors of Sioux Falls to visit 80 parks throughout the year. Our challenge for you is to visit the parks we have featured monthly and post your picture on Facebook or Twitter with the hashtag 80 and 18. Featured parks for the month of November are Fort Sod, Linwood, Norland Greenway, Oakview, Pioneer Plaza, Rotary, Town One, and Veterans Memorial. One of our featured parks for the month of November is Veterans Memorial Park. I'd like to welcome Bryce Block, District Park Supervisor, to tell you a little bit more about this amazing park.
Hello, I'd like to talk to you about Veterans Memorial Park and all of the things that it has to offer. The park was dedicated in 2006, and some of the points of interest to the park include the Veterans Plaza, the pergola columns, the entry plaza area, the amphitheater, the entry plaza flagpoles, and the Congressional Medal of Honor Garden. Two unique areas to the park include the Going Home statue, which was placed in the park in 2009, and the Veterans Paver area. The pavers recognize individual veterans or military personnel and are available in 3 different sizes. Some of the annual events at the park include Flag Day, which is on June 14th, the POW MIA Day, which is the 3rd Friday in September, and Veterans Day, which is on November 11th. This would be a good time to come out and visit the park and recognize those who served our country. Many of the features that you see out here were generously donated by families of members who are in the military or part of a military family. There's lots of beautiful things out here to see and to take a look at. It's a good place to come and reflect, look at all the people that have served. It kind of gives an area of peace, remembrance. It also has beautiful trails to walk. It's a lot to see in this park, so it's a good place to just come and look around. For more information of 80 and 18, visit our website at siouxfalls.org/80 and 18.
As always, thank you everybody for joining me on City Scene. If you're looking to watch this again or for more information, check us out on siouxfalls.org or on YouTube. I'll see you next month. Bye-bye.